I'm Dr. Sywick, one of the physicians at the Pain Center of Arizona. And I'm here today to talk to you a little bit about TPC spine relief. So I'll often tell my patients that if we're going to oversimplify this, there's three kinds of pain. There's a bone pain problem, muscle pain, and nerve pain. It's certainly oversimplified, but let's talk for a minute about bone pain. Simply put, the spine is made up of several components, these vertebral bodies separated by these spongy discs, these cushions if you will. But if you flip around and look at the spine from the back, there are these small joints called the facet joints. Those joints allow you to flex forward and extend backward and twist and turn side to side. When there is degenerative change of those joints, it's as painful as osteoarthritis of a knee or of a hip. The issue is, however, we can replace your hip. We can replace your knee. We don't yet know how to replace the spine. There is a solution though. TPC spine relief offers a way to address those degenerative facet joints. The first way is a more common way that everyone has likely heard about: radio frequency ablation. There are small little nerves called the medial branch nerves, and there are two medial branch nerves that support or give innervation to every single facet joint in the body. Radio frequency ablation is a simple way under live x-ray to place a small needle and to heat the tip of that needle up, in effect to destroy the medial branch nerves. It is a very effective procedure, but here's the problem. Sometimes it doesn't give enough relief or prolonged relief. And why might that be? Well, we do it under live x-ray. We can see where the medial branch is supposed to be and going into that facet joint, but you can't see the nerve exactly. So we place it anatomically where it should be, and we heat it up and we test it, and then we burn the nerve. But what do you do when it simply hasn't given enough relief, or the relief hasn't been for long enough? A radiofrequency ablation typically should give 6 to 9 months or 9 months to 12 months of relief. And by the way, most of the insurance payers now are only letting patients have a radiofrequency ablation one time a year. So what do you do if it doesn't give enough relief? At the Pain Center of Arizona, we have TPC spine relief. It's an endoscopic rhizotomy. And what in the world might that be? Through live x-ray guidance and with the assistance of a small microscopic camera, we place right down to the area of where that medial branch is. This time, through the camera, I can actually find and see the medial branch. At that point, we clip it, we burn it, and destroy that nerve with visualization, which is profoundly different than simply putting the tip of a needle in and heating it up. It is a simple, minimally invasive procedure, a small little poke hole. It is an outpatient procedure that often takes 15 to 30 minutes. TPC spine relief is an excellent option for patients with degenerative disease of the facets. Another application for TPC spine relief is when the vertebral bodies, the structural foundational bones and supports of the spine, bang into each other because those shock absorbers have gotten worn down. We look at images and we find what's called modic changes, and those just speak to how intense the degenerative change or how intense the inflammation is. There's a procedure that we do, again, outpatient, under live x-ray guidance, known as the intracept procedure, where we place a small needle down to the level of that bone, and there's a nerve within that rim known as the basovertebral nerve. We heat up and destroy that nerve within the bone, effectively relieving profoundly that axial pain. Patients that have either the facet pain or this type of vertebrogenic axial pain are typically patients that are experiencing pain across the low back in a belt-like distribution, sometimes worse with bending, twisting, or turning, sometimes extending into the hips or the buttocks or towards the legs to about the level of the knee. So TPC spine relief offers two effective solutions for degenerative conditions of the bones. The first in those facet joints, where we typically start with radiofrequency ablation, or now endoscopic rhizotomy, or the vertebral bodies have the degenerative condition and we do the intercept. Both of these are ablative procedures where we target specifically the medial branch for the facets or the basovertebral nerve for the vertebral bodies. Let's be clear, these are not nerves that have anything to do with you having feeling in your legs or you having strength in your legs. These are specifically nerves that serve the function for that sensation to those degenerative facet joints or to those vertebral bodies. Simple, safe, both outpatient procedures under live X-ray guidance. Check us out for TPC spine relief to get back into life.